Hi, I'm here with Jim Knapp, President, CEO, and founder of VQ OrthoCare. We're here at the San Diego Design and Manufacturing Center. Can you tell me a little bit about how BionicCare aligns with VQ OrthoCare's mission?
I've known about BionicCare and the principles and the technology since the early 1990s. Recently, when it became available, we had the ideal, perfect platform in which to marry it with, and that was through our proprietary osteoarthritic bracing. The product we introduced last year actually combines two tremendous technologies into a singular product that will truly be game-changing in controlling healthcare costs relative to osteoarthritis in the future. Over 50,000 patients have benefited from BionicCare technology, and they have been prescribed by over 4,000 different physicians. The average patient will use this device for less than a year and end up with a better outcome than a patient who had a total knee replacement, for obviously much less money and much less risk.
I was having a discussion with a friend of mine who's about my age, who was about ready to go in to have a total knee replacement. And about that same time, I got a BionicCare brace, of which I said, you know what, I'll just try it. So 4 months later, after trying this and being on it for about 1,000 hours, I'm back with my activity, I have no pain, and I've had an incredible experience with this.
The scope of this problem is enormous. It is what I call an epidemiological perfect storm comprised of three factors. The baby boomers are hitting the age of 50, which is the age of arthritis. The second factor is, as a population, we are heavier than we've ever been. The third factor is we are living longer. Recently, the American College of Rheumatology published a study on the cost of osteoarthritis to the American healthcare system. They estimated that on an annual basis, the cost is $186 billion a year to treat osteoarthritis in this country, and it afflicts 27 million Americans. One of the most common elective procedures in this country is a total knee replacement. There were 545,000 total knee replacements done last year at a cost of $15 to $18 billion. By the year 2030, the estimates are there will be 3.5 million total knee replacements performed every year, which is an increase of 700% over current levels.
The cartilage in the knee doesn't have any direct nerve supply, blood supply, or lymphatic supply. And when we step, water and positive ions go out, the negative stays in. That creates an electrical field and an electrical signal, and we took that signal and duplicated it and put it into the BionicCare generator. The BionicCare technology has been very well studied, with two gold standard, double-blind, placebo-controlled randomized studies. And what they showed was that with an average of 11 months of use, the BionicCare patients 4 years later did very well. 62% of them did not have to go to knee replacement. Whereas the control patients without BionicCare, only 7% had not gone to surgery by that point. There was another long-term study published with BionicCare several years ago that relates to our patient Marcia. As you can see here, at around 400 or 500 hours, there was benefit, but the substantial benefit came after 750 hours. And by 1,500 or 2,000 hours, patients were doing as well as they had if they had a knee replacement. But moreover, they can not only walk and hike and do normal activities, but with BionicCare, as in Marcia's case, she was able to get back to a full quality of life, doing the other activities she really enjoyed.
In 2005, the consulting firm Milliman Global performed an actuarial analysis of the original BionicCare technology. The Milliman study demonstrated a savings of $400 million per year in healthcare savings due to the use of the technology. We believe updating that analysis involving the current BionicCare O-Active product, we would save the healthcare system over $3.1 billion. The positive implications to society from the increased lifestyle benefits and the decrease in healthcare costs are enormous.